Hi, good afternoon. This is Santa Clara County Supervisor Dave Cortese. You can see on the screen already all of our contact information, and we're happy to be back here again this week. This is a weekly Saturday update on the pandemic, COVID-19, how the virus is treating us here in Santa Clara County and how we're dealing with the virus. And we have with us very, very special guests, the CEO of the Valley Medical Center and our entire health and hospital system here, Paul Lawrence. And it's going to be interesting talking to Paul about something that's been on everybody's mind, is how is the hospital system really holding up to all this? How vulnerable is it these days? We know that a few months ago, the thing that everyone was worried about was the idea that our hospital system might get overrun by patients, and it certainly was stressed and stretched at times, and we saw that happening all over the world. We saw it happen in Italy. We've seen it happen more recently in New York. We're seeing it now currently in a couple of states in the union that opened up early and are now worried about having to spill over their hospital capacity and maybe create emergency quarters again. So we'll ask you to talk about some of that in just a minute, Paul. Let me give the weekly update here that I try to touch upon every week. Cases since the last Saturday that we were here went up by 265. Deaths went up by 6, and I consider this a really important number, not just because it's the most profound number that we talk about. These are 6 lives. These are somebody's loved one. These are people from our community right here in Santa Clara County. Statistically, probably from San Jose, because that's where the majority of the infections are, but we don't know that per se. I'm just saying there are 6 people that aren't with us anymore as a direct result of COVID-19, not because of any other reason. And the good news is, if there's any good news about a statistic that has to do with mortality or morbidity, is the fact that it's 6. It's not 14 or 28 or some higher number. When we started doing these programs, Paul, on Saturdays, it seemed we always had double digits, and then they dropped down to the teens. I remember the day I was here, it seems like about a month ago, and I said, wow, it's good that we only have 2 per day for a week. And again, I don't mean to be dismissive about the loss of life. It's never good. Only good number is 0. We don't want anyone losing their life due to COVID-19. But to be down to single digits now, and last week we were in single digits. It's like I said, it's been about a month since we were in double digits. That must have everybody in the health system feeling a lot more encouraged and positive about the community's cooperation, about shelter in place, and how all the rules are working at this point. Let me just mention that testing, which was promised to go up, we've been talking about that here every week, how the county, including the Board of Supervisors, has been investing in more testing, trying to get to the bottom of who's contagious and try to prevent clusters from occurring by figuring out who's positive and who's not. That number was 15,850 people tested last week. That's great. So that is an outstanding number. It makes me feel a lot better. Obviously, we have 2 million people in the county, so it takes a lot of tests to get through the population. But then there's some discussion about this: does everyone really need to get tested, or do we need to have enough testing going that we're picking up on where the contagion is, on things that are happening before they happen, so to speak, before there's a spread of the virus. And then if you want to look at the period of a month, going back a month ago, confirmed cases climbed from 1,621 to 3,117, or an increase of 1,496. So in a month, the confirmed cases almost doubled. Now, some of that is because of more testing. I'm sure we may have had a lot more cases before that we weren't aware of, because testing was something all across the country that got going very slowly, not just here. And now we're up to 150 deaths, which over a month's time is an increase of 96. We only had 54 a month ago. So that is almost tripled in a month. And again, it's, as I said earlier, talking about those mortality numbers, it's always going to be a best of times, worst of times discussion. We don't want any. We like seeing the pace slowing down. On the other hand, there are very few things that can cause 150 deaths in a community over 3 months' time that wouldn't be considered very dangerous, very scary stuff. And it will be interesting to talk to you about that. You see it firsthand every day, Paul. I'm going to stop with all the statistics at this point, but if people have questions, we'll get some callers in. We'll get some text messages. I'm sure people are welcome to call in. We have two people assisting here that you can't see on the screen, because we're trying to stay 6 feet apart like we're supposed to do. Distancing is still really important. Masks are really important. We come in here with our masks on. But I just want to mention that Tara is here from my office, and also Janice Rombeck, who's oftentimes up here before the camera with me, and we appreciate the technical assistance from Min and the donation of the studio time here to help us get the word out here at Vietbay. We're very grateful for all the charitable work they do in the community. So Paul, any of those thoughts that you want to touch upon? It'd be nice to maybe further, if you could further introduce yourself. I didn't give you the grand introduction, but let people know who you are, what you do, what you're responsible for, and then how this all looks to you.
Well, thank you, Supervisor Cortese, and it's a pleasure to be here. I would say that some of the topics that you've discussed, particularly around how people have viewed hospitalizations, you're right. The numbers have steadily come down. They've stayed down. They've been averaging anywhere from 50 to 60 hospitalization in the county of Santa Clara. But we are still admitting, as we discharge patients, we're still admitting patients that have COVID. And the good news is that we're not seeing the same level of need for ICU level of care, intensive care unit level of care. But the fact is that they need hospitalization. And then, of course, after the hospitalization, we're following the mortality and the number of deaths in the county. And as you've noted, that, occasionally we'll have a death here and there. And what we all know is that obviously it's a community disease. It impacts the community, but it's actually very personal. It's very personal when it gets down to an individual that's in the hospital, a family member. It's very personal when someone is lost to this. So we always have to be vigilant around what we've been talking about in the community. As we relax the shelter in place, we have to be cognizant about the fact it's not only about ourselves, but about other people around us and how they can affect other people that may be further at risk, whether it has to do with an individual that have multiple comorbidities, chronic conditions, and even beyond that, what we've seen in healthcare are individuals much younger being affected by COVID and being hospitalized. Individuals that are in their 30s. Occasionally we'll see a child, a pediatric case. So this really does cut through all the segments of our community. Mm-hmm. And the other thing I think the supervisor, you've been following this closely, is that, in those communities, lower income, the Hispanic, African American, Black community are disproportionately affected. And I think as a healthcare system, as a public healthcare system, we want to continue to work with those community organizations to make sure that we're supporting those communities as we go through this. And the other topic you mentioned, of course, is testing. And I think the County of Santa Clara, in working with the county board in terms of directing more surveillance testing through the public health department, is making a difference in the sense that people are more cognizant and aware of the fact that that they have to take care of themselves. If they get tested, it's a reminder that this is by no means over. And the number of testing sites continues to grow. And I think the number in statistic that you gave is really telling. I mean, just in the past week alone, 7 days, an average of 2,300 tests per day. And of course, the county is trying to get up to 4,000 per day. And although that's a number, the goal, I think in the end, I think we're talking about availability of testing and making sure that people have easy access to those testing sites.
And as a hospital administrator, I mean, the CEO of one of the largest public health and hospital systems in the country. I mean, you have VMC, you have O'Connor, you have St. Louis, you have a dozen clinics, you have community-based agencies that also connect into the system. Even the public health department, Sarah Cody's department, is connected to you in some respect. What is a hospital's role on the testing side? I know the public health department really put a demand, a requirement out recently. How important is that all the hospitals are participating in this process, not just the ones you control?
Right. Well, first of all, as a public hospital owned and operated by the county, we work very closely with the county health department in the county EOC. So that relationship has really allowed us to accelerate our ability to provide these tests and testing sites within the community. And so the healthcare workers within our healthcare system, which includes, of course, Valley Medical Center, O'Connor Hospital, St. Louis Hospital, and of course all of our community health centers, staff from all of these locations are jumping in and taking on assignments at these various testing locations. They're not only focused on supporting testing sites that have been, of course, put out there via the public health department, but have also worked very closely with the homeless healthcare program,
right?
Looking at and supporting congregate shelters, doing testing there, going into the encampments and providing support to our homeless population. So pretty much the healthcare system, the county healthcare system, has been right there with the county EOC to make sure that the staffing and the resources available.
And the EOC is the Emergency Operations Center,
right?
With the kind of the brain trust of the whole emergency response. So you have to support them as well, and right. they support you and vice versa.
We work very closely. So the County Emergency Operations Center is consisting of multiple different departments in support of the public health officer, Dr. Cody, in the various initiatives that have to be dealt with. And that's something I think for all of us that work in healthcare and understand the importance of public health, to be able to be aligned both in terms of the healthcare delivery system and the need to support the community from a public health perspective, has really helped in this situation.
So we have mobile units testing. We have some community-based agencies partnering in testing. The other hospitals are called upon to do testing. Now, but somebody has symptoms, and I ask this question because there's some pretty consistent predictions that there's going to be another surge at some point, whether it's a week from now or whether it's this fall, that we're not done with this, that there may be some more pressure on your hospital. But you don't want people with symptoms just walking right into Valley Medical Center, do you? I mean, what is the right thing to do if I find out one of my family members, has a persistent cough or a fever or has been had the same challenging headache now for 6 or 7 days in a row? What's a process you would like to see people follow at that point? You want them tested somewhere, right? How should they go about it is what I'm asking.
Well, first of all, I think we should draw the distinction between someone that is asymptomatic, an individual that is not showing any signs of illness, to make sure that in those situations, to go to, if they want to be tested, to go to the website, and it's Santa Clara County free testing.
Right.
.gov. To go there and actually identify a site, register online, and or call and make an appointment, or go to one of the drop-in sites that are listed. And that's if you're asymptomatic. I will say that, since